By Neil WeisfeldSeveral, leading Democratic candidates for president support Medicare for all to guarantee health coverage for everybody. It's easy to see why. For three main reasons, Democrats shouldn't push this single-payer approach. These reasons are, in turn, practical, political, and policy-based. First, the practical. Medicare for all has roughly a 0% chance of Senate passage. As the Founding Fathers intended, that body is, and always has been, dominated by mainly rural states with relatively few residents. Small, rural states tend to be conservative and to vote Republican. Under the Senate's filibuster rules, key legislation requires 60 of the 100 senators' votes. No one has come up with a realistic way to end the filibuster. And no Republican senator is going to vote for Medicare for all anytime in the foreseeable future. Second, the political. Some people believe that, when government pays for something, it becomes free. It doesn't. The cost shifts to taxpayers like you. Americans spend $1.2 trillion per year on private health insurance. That's on top of $1.3 trillion for Medicare and Medicaid. Moving $1.2 trillion over to the government would cause the average taxpayer's bill to climb $8,000, according to my calculations. Maybe you're willing to foot a bill that size, but do you think most voters are, especially if they're already covered by Medicare? Demands for Medicare for all will sharply reduce Democratic chances of victory. Third, the public policy issue itself. Private insurance is popular because it pays for care that physicians recommend and people want. Under Medicare for all, the benefits and pay structures would be determined by Congress, not by professionals. By folks like Mitch McConnell. Historically dominated by conservatives, Congress will respond to ideological pressures, forget paying for abortion services, for example, and to campaign contributions from large healthcare providers. Is that what Democrats want? Moreover, Medicare for all wipes the states out of the picture. States serve as laboratories for innovation, and one of the great strengths of America's healthcare system is its diversity. Removing states and private companies will mean one list of paid health services, one all-powerful bureaucracy, no alternatives. This in a healthcare system that accounts for nearly 1/5 of the whole U.S. economy, a system clearly large enough to sustain many different health plans and ideas. Disturbingly, the candidates' focus on Medicare for all leaves almost no time or attention for other healthcare issues, except for rising drug costs. For example, candidates should emphasize the need for more federal funding to train health professionals and to recruit and train more aides for the infirm elderly. As things now stand, even if everyone has Medicare, there won't be enough healthcare workers to provide the needed services, and most shortages are getting worse. Other areas generally ignored by the candidates need greater funding. One area is mental health care and research, which affects suicide, opioid addiction, domestic and gun violence, and other maladies. Another area is public health, to prevent and contain epidemics and fill huge healthcare access gaps in both urban and rural communities. Still another area is quality improvement, to identify and establish the best medical practices. The push for single-payer crowds out these causes. Candidates have little time to promote them, and Medicare for all would leave little money to pay for them. The emphasis on Medicare for all also takes attention away from the one overriding problem facing our healthcare system, its enormous cost. We spend 2.5 times more per person on healthcare than the other industrialized countries, yet our outcomes are generally no better. The federal government is experimenting with ways to improve value, but results so far are disappointing. More imaginative approaches are needed, and solutions are unlikely to emerge from a complex politicized federal bureaucracy. Happily, there is an alternative. The Affordable Care Act, or Obamacare, has greatly expanded coverage through subsidies. It would cover millions more if allowed to work as intended. We turn our back on this achievement. Let's improve it, learn from it, and then proceed from there. Let's be bravely practical, not dogmatic. Neil Weisfeld is a retired health policy researcher in Princeton. The StarLedger/NJ.com encourages submissions of opinion. Bookmark NJ.com/opinion. Follow us on Twitter at NJ_opinion and on Facebook at NJ.com opinion. Get the latest news updates right in your inbox. Subscribe to NJ.com's newsletters. Let's block ads. Why?